All right. Hey, everybody. How you doing today out there in Facebook world? Dr. Bunio, how are you doing?
I'm doing well. Thank you, Chris.
Very good. So I noticed you have on a yellow mask today. What's happening with the yellow mask?
That's right. Well, those of our regular listeners who may remember, we had
fans.
Where the chief rolled out the tribal dashboard, and we now have risk levels, COVID risk levels, and so there's red, orange, yellow, and green.
Okay.
Obviously, green is as good as it gets, and red is trouble.
Right.
And so I offered to wear a mask to represent our current risk level, and we are currently at the yellow level.
And what does the yellow level signify?
Yellow means that we are still having community spread, that it's really important that people keep following our advice, but that things have improved a little bit.
Okay.
So I can't say that we can relax, but we want to be honest with the community and say, listen, what you're doing is working. Wearing your masks, washing your hands, and keeping your social distancing. So if we creep up into the orange area, and this is based on how many new cases we get per day.
Right.
If we get into the orange level, that means we need to redouble our efforts.
Okay.
We need to really avoid what we call mass gatherings, large groups of people, especially if you're not wearing a mask. Because if we get into the red level, then that's where we get into the area where something might have to be done.
I gotcha. So we're doing okay in the yellow.
Yes.
Well, obviously we're going for the green. Green means that we have essentially knocked out a lot of the disease in the community. Is that right?
Yeah. So, right now this would signify that we can, we don't have to shut things down. We keep the economy, ramping back up again.
Right.
The virus is not going away.
Okay.
But if we can keep in the yellow and maybe down into the green zone, then we're on the right track.
With a lot of the new data that we've seen come out, and it's not new data, it's just it's the way we've displayed the data and delivered it. I guess we see that being in the yellow has shown that we have active cases.
Yep.
And that they've healed. Like as they heal off, the number decreases. It drops us down toward the green, right? As people heal up and recover from the disease. As we get new cases, that ticks it back upward. Is that right?
Right. This is all based on new cases. So we're not counting cases, back in March or April. This is how many new cases do we have per day?
Gotcha.
And then we compare that to a standard based on population. So, like I said, we were in the orange. We're now in the yellow. That is better.
Good.
Places like Florida, Arizona, they are so far up in the red, they're even off the chart.
I gotcha.
They're really bad.
Gotcha. I thought on your mask, maybe you had just been outside and there's just a lot of maybe pollen.
A lot of pollen,
gathered on it. But how did you actually get it yellow?
Well, my wife helped me with this. She was intending to get some dye and dye some white masks, but we ran out of time, so this is yellow food coloring.
Okay.
So it's, we will improve the quality of the mask over the next few weeks. And
this is also how I look after I make scrambled eggs.
Yeah.
And so, I'm whipping it and beating it so hard it just splatters everywhere. So I can see a lot of ideas coming out of this. Let's go ahead and get the green mask ready. I don't know what you'll use to dye that one. There's some algae in my pool you can use.
Okay, well, I appreciate that.
Yeah.
I think we'll see what she comes up with.
And we won't worry about the orange and red at this point because our community is going to keep this thing in the yellow, and then eventually we're going to get rid of it.
Yeah, that's our hope. I mean, we know that everybody's trying.
Yeah.
I'm seeing a lot more mask wearing out there. If people aren't wearing their masks, I see them carrying them, outside, so that the minute they go indoors, they're complying with the chief's advice and the North Carolina State guidance that you need to wear a mask indoors if you cannot guarantee social distancing. So I think this is just people. It's becoming a normal way of life.
It is, and it took a minute to kind of adjust to some of those things in our daily life, but it's getting better, I think. Yeah,
and one of the things there have been some people who refuse to wear a mask, and I just wanted to take a minute and say they're not bad people.
Right.
They're in everything. There are people who we call them early adopters. Like the people that are standing in line to get the very latest iPhone.
Right.
And then there's other people who like to sit back and wait. maybe, they've got a story, maybe they've been burned before, but so not everybody's going to jump on the bandwagon right away. We've got more and more and more data. There's going to be some stuff coming out, I've heard, that masks work. And they protect you, they protect other people. And so some people have held off, but I think now more and more people are
getting on board with that.
Yeah, so again, I just want to emphasize that, people that haven't been wearing their masks, I see them starting to wear their masks, and I think that's great.
That's great. It's great to adopt. Now, with that being said, I know that I imagine you probably have a Motorola Razr, that you're not first in line to get an iPhone.
I loved that phone. It was like a Star Trek communicator. You could flip it up and talk, and
it was always there, always worked.
It stopped working.
So there have been some, obviously this week we've had a lot of news, a lot of buzz, for lack of a better term, regarding some cases that we've had in the community, I guess. Some of them involved maybe even the young children in the daycare, employees in certain areas. Why is it important that the community know and that we emphasize that that's going to happen, and that we do have plans for when that happens, and that these places are secured and safe measures are taken right after that?
Yeah, one of the benefits of us, getting started on this so early, I mean, we were up at the hospital, and public health, we started talking about this back in February, is we've had a lot of practice, and we have built our contact tracing team so that when we find a case, we can respond to it very quickly.
Right.
Again, just want to emphasize to the public, if you get a call from the hospital or from public health, answer the phone, share your information. We have actually been able to tamp down a couple of very worrisome cases.
Okay.
Mostly tied to these big, we call them mass gatherings.
Okay.
Large groups of people. Even if you're outdoors, I mean, it's, cookouts, birthday parties, parties, at the lake and whatever. Even though outdoors is better than indoors, it's not a guarantee.
Right.
And so we've had a number of these cases, and we've been able to just have our team hone in on that, and we've been able to suppress them. So,
good.
Just be careful out there.
Right. So let's get into some of our questions because they're related. Now, should we be getting our kids tested at this point?
Well, I mean, obviously, if your child is sick, contact your primary care provider, contact the team. They'll advise you whether you should have your children tested. We know children can get the virus. They tend to have a less serious illness, but they can spread it. And then, of course, there are those rare cases where they have life-threatening illness. So get your kids tested.
Okay.
Especially if they're sick.
And that's the same test, by the way, for the kids.
Yeah.
They're still doing the nasal test.
It is the same test.
Okay. So that could be uncomfortable for some. So just really, if you're concerned, go ahead and do it. But the criteria has changed for what is considered a direct contact. Can you explain what has changed and why?
Yeah, the CDC changes this based on new science and new evidence. So what they're saying is a direct contact is someone that you have been less than 6 feet for 15 minutes or more. Now, these are just rough guidelines. We've talked about this before. How long does it take to catch the virus from somebody? If somebody sneezes or coughs and you're not wearing a mask, it'll take a couple seconds.
Right.
So this is just sort of general guidance that the CDC has been updating. And right now it's less than 6 feet for more than 15 minutes.
Okay. And does it matter if you're wearing a mask at that point?
We believe it does.
Okay.
That if you're wearing a mask and the other person's wearing a mask, the risk, you still may be considered a direct contact.
Okay.
But we believe the risk is way down.
But the risk at that point is substantially mitigated by both of you wearing masks within 6 feet.
Yeah, there was a study I was just reading this morning that said if you were wearing a mask, masking would reduce the infection rate in a household by 80%.
Wow.
So unfortunately, you have to be wearing the mask almost before you know you're sick a lot of the time.
Right.
We still have that where we're spreading the virus before we even know it.
Realize that we have it.
I think the message is if you have somebody in your home who's an elder or who is vulnerable, you may want to practice a little bit of the 3 W's. Right. You know.
And it's very important we bring it up because we're really hot and heavy right now on mask wearing, but let's not forget to wash hands. Like the surfaces are still also contaminated, right?
Yeah. Wiping down surfaces was also shown to reduce transmission.
Okay.
I think by about 77%. It was just a really interesting study.
Okay.
So a lot of people think, well, once it's in your household, everybody's going to get it. That's not true.
Right.
It depends on how effectively you can isolate that person.
Okay.
You
Gotcha.
know.
Now, if I end up testing positive, should I call the people that I know I've been around, or do I wait for the contact tracing team to do that for me?
So the contact tracing team, if you give them that list of names, they will take care of that for you, and they will not reveal your identity.
Okay.
You know, they'll just say, "Hey, we believe you've been near."
What
somebody.
if I was around Bob, but I don't have Bob's number, but I know I was around him. I was drinking coffee down at the coffee shop, and he's just standing there with this group of people. Like, what do we do in that situation?
So there's nothing to stop you from calling people and telling them. You know, if you want to do that, sure, go ahead. But the contact tracing team is going to be the one that's going to be reaching out to them.
Okay.
Long story short, we would rather people know that they need to go get tested than not. Gotcha. So if Bob lives out in the woods in a cabin and he doesn't have a phone, if you want to send somebody out there or a carrier pigeon or however you communicate with Bob, let Bob know that he needs to be tested. The other thing that the contact tracing team does is it's going to apply that criteria. So if you were next to Bob for 2 minutes, he's probably not at high risk.
Not the high risk,
right? Okay. But if you were out hunting or fishing, you were close to each other, or
well, if I'm hunting with Bob, I got his phone number, I'm sure.
Yeah, well, I hope so. Yeah.
But no, I'm sure this is a very far out there outlier as far as being around someone you may or may not know that well, but I just wanted to make sure that you have an option, I guess, that you could reach out to somebody to get in touch with them.
Yeah.
Small community, we should know how to get in touch with people.
Yeah, word gets around, and if we have a case where somebody does not, sometimes we have people that are kind of reluctant to tell us who they've been around. If we have a case like that, that's when you see these public service announcements. We'll just say, hey, if you were here on this date, maybe go get tested.
Yeah.
And so we're just trying to protect the community. I mean, we're not trying to get anybody in trouble.
Good. One of my friends was contacted by contact tracing and notified they were a direct contact, and we had went together to dinner together the day before. Do I need to worry?
Okay, this is a really good question. So this is basically a contact of a contact.
Right.
The risk there is probably low.
Okay.
First of all, I would say, hopefully if you're going to dinner, you should be keeping your distance from people who are not in your household, right? If you're going to go to dinner, do it safely.
Gotcha.
But if you didn't, then you're a contact of a contact. You could consider getting tested, but I would say your risk is pretty low.
Okay.
You may want to just keep in contact with that person. They are going to be asked to be tested.
Right.
And if they test positive, then
you might need to
you're up next.
Okay, interesting. So how long should I wait to be tested after I've been in contact with a COVID positive person?
Okay.
What precautions do I take while I wait?
So if you've been in contact with someone by that criteria, then the sweet spot is about 8 days.
Okay.
Or the very first day you start feeling sick. So if you start feeling ill, we think that, maybe you've been in contact with that person over several days. Let's go ahead and get you tested. Let's figure this out. The precautions you should take while you're waiting in this is you should be quarantining. Okay. You should stay home. You should isolate yourself from vulnerable people. Unfortunately, we are experiencing some longer delays in getting these tests back.
I was going to ask about that today.
This is a problem across the country, and we are actively working on some different types of tests so that we can get them back quicker. But right now, this is a 1 in 100 years pandemic. Right. You're just going to have to, quarantine yourself, get tested, and stay home. If you get tested too early, there's a really good chance. Like if you were in contact with someone yesterday, we tested you today, it's almost 100% that test is going to be negative.
Right.
Your body has not had enough time.
For the virus to replicate.
Yeah, the virus has not had enough time to replicate and get into the back of your nose where we take the test. So
I'm starting to use real medical terms now. Have you noticed?
It's very impressive.
I think I'm going to go ahead and apply for med school after this based on
I'll be happy to write you a letter.
There you go. Thank you.
Yeah.
Okay, so that answers that.
Yep.
What do I do if I was around someone who just tested positive, but I have not been contacted by contact tracing team?
We actually do encounter this a fair bit. People will just come up to the drive-through testing, or they'll call up and they will tell us they think they were near someone.
Okay.
So what should you do if you haven't? And people's memories are not perfect.
Right.
We can't remember everybody.
I have ADHD. I can't remember what we did 5 minutes. I don't even remember the question I just asked you.
We can't remember all the people we've been around. So if you think you've been around someone, call the hotline.
Okay.
We can talk you through it, see if you were really a contact, and we can schedule some testing.
Okay.
If you come up to the drive-through, if you just do sort of, we get people that just don't schedule, but they come up. We prefer they schedule, but if they do, we'll ask you, why are you here?
Right.
Are you feeling sick? So tell them there, hey, I was around Bob, and then we'll make a note of it, and then we'll make sure that we track everything.
Yeah. So Bob, I was around Bob. We were out together for a minute, and he tested positive, but I hadn't been contacted. I just want to, out of safety and precaution, go ahead and be tested myself.
Right.
Is it appropriate?
Yeah, we can do that. So we're going to tell you that if you're around Bob for a minute or less, particularly if you were wearing your mask like we're all supposed to, your risk is very low.
Okay.
You probably don't need to be tested.
Okay.
But if you want to be tested, hey, that's what we're there for.
Because the reality is, if he's tested positive and you were near him, would there have been enough time? I guess it's all hypothetical at that point.
Many different factors, right? Did Bob cough or sneeze on you? Were you wearing masks? How far apart were you? But again, for general guidance, if you are really worried and you want to get tested, the 8 days after you were near Bob is the best time to do it. Or the first day you're feeling sick.
Gotcha. That's a good rule.
Yeah.
Rule of thumb there.
Yep.
Someone that was in line in front of me at the grocery store tested positive a few days after I've seen them. Should I be tested? And it falls along the same lines, I guess.
Yeah. So most of the grocery stores have those little marks, so you're supposed to stand 6 feet away. The other benefit is that person is not facing you, I hope, unless they're on their phone and they turn around. Okay. So I think that risk there is pretty low.
Okay.
And again, when you get back from the grocery store or when you get out of the grocery store, use your hand sanitizer.
Right.
Just take all those precautions.
Right.
So I wouldn't recommend necessarily getting tested.
So that's a low risk if they're just in front of you and they test positive. You're at a very low risk at that point.
Yeah. And once again, they may have touched something.
Well, I was getting ready to say, like when I'm in line with people, it's usually we're going after the same bag of chocolate-covered almonds, and so then it's a fight.
Or if they were just reading the Cosmopolitan magazine, they put it down, and you picked it up because you wanted to do the test. So in that scenario, you're not going to catch it just from touching it. It's when you touch it and then you touch your eyes, your nose, your mouth. So if you hand sanitize, you're good, even if they touch that.
And so for me, it's inevitable because I'm going after the chocolate-covered almonds that immediately I open them and start to eat them. So that's a danger zone. I need to wash the bag off or wash my hands.
That's actually an interesting point because, we've never proved that you could catch it from eating something.
That's interesting.
Right? It's all...
Maybe onto something here.
Right, yeah. So you could probably eat the almonds.
It might be my thesis for my medical school.
Just don't stick them up your nose.
Okay. Falling apart here. Sorry, Jason. I didn't mean to blow your eardrums. There's been people calling for the border to close and upset about tourists potentially bringing virus to our people. Am I more likely to get the virus from someone coming into town to visit than I am from going to a friend's barbecue?
Okay, well, that's a very long question.
Specific and long question here.
So we actually started looking at this because we understood that the community was worried about, tourism. So there's a couple of different factors here. How likely are you to be near a tourist?
That's a good point.
Me, not very. I may pass by them in the grocery store, but I'm not going to spend a whole lot of time with them. So I think the risk there is pretty low.
Okay.
But if I'm going to a friend's barbecue, unless I'm wearing my mask and keeping my distance, I think that's actually a higher risk.
Yeah, if you think about the odds, odds there.
So we looked at all the positive cases that we've had, and we just did this this morning. About 25% of the cases are related to people in the same household. So no tourists there.
Okay, so it's just a mother, father, or a mother, child.
Yep. Another 25% are related to these gatherings, right?
Okay, the mass gatherings.
Cookouts, some funerals, and then there's another 50%. We call it community spread.
Okay.
Somebody tests positive. We don't know where they got it.
Okay.
Could it have been a tourist? Maybe. But I think we have to ask ourselves, how, aside from the casino, how often do tourists really interact with us less than 6 feet for more than 15 minutes?
Right.
So I think the risk is pretty low. This is where we are. The virus is everywhere.
Right.
We are probably, we may be just as likely to give it to a tourist as they are to give it to us. It depends where they come from, too. I mean, people coming from high-risk areas can be a little bit concerning. But I think, even when we closed the border, we didn't stop people in Cherokee from traveling back and forth.
Correct. So it's still a lot of it is in our court as far as it's happening when we're attending these mass gatherings. It's happening when we're attending our friend's house, when we're just traveling and bouncing house to house still. Some folks are doing that. And so we're still kind of responsible for a lot of this spread internally here. Yeah. Some of it could be tourism, but we're not pointing a lot of the data there in that direction, right?
Right. Yeah. I mean, I think the community can take some credit for keeping us in this yellow zone.
Right.
Right. But again, all I can say is what we're seeing is when people they relax a little bit and they go, okay, I'm so tired of just staying at home.
For a fact, it's hard to do.
Talking to just my immediate family or just watching Netflix. I'm so tired of that. People are just aching to get out. We're social animals, right? Right. And when we do that, we immediately. One person in a big gathering, that's where we have the problem. That's where the risk is.
Gotcha.
If you're just going to again go play cards with Bob, apparently he's a good friend of yours.
He's a real
you
good
do a lot of stuff together.
Get his phone number.
Well, then if Bob turns up positive, he's only infected one person.
Okay.
But if you and Bob go to a cookout with 50 people, there's 50 potential contacts.
Gotcha.
So
okay,
that's what we're worried about.
That's what we're battling against right now.
Yeah.
Well, good. Well, I hope the community's watching and taking note of the data that's coming out, and if they have questions, to make sure they ask it of the groups that are sharing that data, so that we can get the correct answers out there. I don't think people need to panic at this point. It sounds like the numbers and being in the yellow indicates that we've kept kind of a even kill with this infection rate. Is that right?
Yeah, we're doing okay. I mean, the virus is out there. It is still dangerous.
Right, absolutely.
So I don't want people to relax completely, but I also don't want them to panic.
By no means trying to say that we're over the hump here. We've got a lot of work to do still, and this thing is still active in the community.
Yeah. Like North Carolina's in that sort of orange zone, so we're spread out.
A lot of the neighboring
states. We're better off.
Yeah.
I would not want to be living in Raleigh or Charlotte right now. That is trouble. How do you social distance in a big city?
In a city,
it's impossible.
It's impossible.
Yeah.
Okay, so I got something special to show you. This? Check this out.
Oh wow!
What do you think of that?
Well, who is this guy?
Do you know this guy on the left?
Who is this?
It's kind of gangster.
Okay, yeah. Well, it's a good message.
Don't stand so close to me.
Yeah.
We got 6 feet here. Sting saying that. Sting and the Police.
Yeah.
And also Dr. Bunio says that.
Well, we're kind of on the same level, I think.
That's it.
Yeah.
I think you're on that level. So these will be coming out all over town. We're going to put them all over throughout town just to kind of help have some fun, help people remind people of the 3 W's, to have some fun with it, to share it with their kids and their families. Again, a lot of this messaging is just to kind of reinforce what we're saying. It's easy to kind of forget that we're in the middle of a pandemic sometimes when we're trying to just enjoy our lives and survive some of this stuff. But this is certainly one of the tools that we're going to use. We're going to put some more of this messaging out, and you're featured on it. I think it's funny.
Well, that's awesome. I'm humbled.
Oh, it does match. We'll have to fix the mask up a little bit, put some color and tie-dye in it.
Yeah, we're okay. Thank you.
Well, no problem. Thank you for being such a good advocate for the public here and keeping people safe and families safe in the community. I think the work that the hospital staff is doing is tremendous. I know that everybody struggles with this, and so continue to keep up the good work up there and keep the staff motivated and know that this is a very meaningful thing for the community.
Thank you.
Shashi has some input.
There's a question.
Okay.
Okay.
What about relatives moving here to live with family to avoid the virus in high-risk areas or hotspots? What would make this transition safer?
So they're coming from an area that's high risk.
Okay,
Yeah.
so the question is, if we have family members that are coming into the community to stay with family, extended family, to avoid hotspot areas that they're currently living in, what's the safest way to make that transition for those family members?
Well, put them on a 14-day quarantine.
Okay.
If they come here, I don't know, put them in the garage or a tent or something, like isolate them from the rest of your family.
Yep.
If you want to get them tested, that's another strategy that could be used. But if somebody is exposed to the virus, they could become sick anytime in the next 14 days. So if you test them after they've been here a week, it's not a guarantee.
Right.
Safest thing is 14-day quarantine. After that point, if they're feeling okay, the risk is pretty low, and then they become part of what we call your quarantine bubble, right?
Right.
It's like these are the people that if any one of them tests positive, the whole household is probably going to have to quarantine.
Gotcha.
So I get it. People are trying to get away from some of these hot spots because of all the things we've talked about. It's so hard, not
to be around
not
people
to be
in big
exposed.
cities. And definitely coming here is a lot more open air and spread out community. So we're seeing some of that. We're seeing people coming into town and staying with family to kind of escape some of that.
Yep.
Make sure we do it safely.
Yep,
if you're out there, just
absolutely.
make sure you're doing it safely. Quarantine. Make sure after 14 days, like Dr. Bunio says, you're probably in a good place at that point.
Yep.
Okay. Any other questions, Shashi? All right, Dr. Bunio. Well, I look forward to seeing you again, and hopefully you have the yellow mask on, maybe a green one next time, and we'll keep the public updated. If you're out there in the community and you have any questions regarding what we've discussed today, or anything new that we haven't discussed that you've maybe seen out in the media, or a question that your family has, please post it on the Facebook page, on the Cherokee Indian Hospital page, so that we can get those questions up here and asked and answered by Dr. Bunio and his fantastic wealth of knowledge and his fame and fortune now in our community. He's res famous.
I have a team of researchers.
Okay, a team of researchers.
Yeah, both of them.
Yeah, I need a hairstylist. It's about time to get a hairstylist in here. I got this thing's getting out of control.
Get the clippers.
Yeah, I kind of like it. But okay, so thanks for watching us. And again, if you have any more questions, post it on the Facebook page, and we'll see you again soon. Data Dog, how are you?